This is a response assessment platform for development and validation of imaging biomarkers in oncology. This is the opening screen with a series of tools and palettes. Here listing our customized quantification palettes. We can open, for instance, a de-identified anonymized patient scan, look at different views, 1 up, 2 up, drag in the appropriate series from the baseline study, drag in the appropriate series from the follow-up study, cine or scroll through this study. You notice this patient has multiple liver metastases as well as a retroperitoneal lymph node metastasis that we see on the upper panel. Here, the two baseline and follow-up studies are now linked together. We change the window level settings easily if needed. And here now using the default abdomen level. We're magnifying and we see the interaortic caval lymph node at baseline and at follow-up. We use our customized segmentation tool to draw a region of interest, a rough region of interest, and then the computer algorithm is able to identify the borders and quantify the lesion precisely. Notice adjacent to another lymph node, to the right, to the patient's right, and adjacent to the aorta, and it propagates this through the individual slices. A successful segmentation of a retroperitoneal lymph node. We now look at the lungs in the same patient, and again notice multiple pulmonary metastases. We identify a solitary metastasis adjacent, however, to several vessels and are able to use a customized lung metastasis segmentation algorithm and segment that lesion in 3 dimensions on multiple slices. Similarly, we have tools for the liver. And here's a difficult liver lesion. It's heterogeneous. It's up against the border of the liver. A rough region of interest is drawn, and then the computer is able to segment it. Notice that the segmentation is not perfect, so we use our editing tool to eliminate that error and better identify the appropriate segmentation for that lesion. We confirm these, and then the program automatically outputs a tumor tracking tool, noting the liver lesions, the lung lesions, and the lymph.
To open Weasis, double-click on the Weasis app from desktop. Next, open the Excel file and find the patient that you are assigned to. Under the image path column, select and highlight the path for that patient from X colon all the way to the end of patient ID. You can use Ctrl+C or right-click to copy the image path. Now go back to Weasis, click File, then Import, then DICOM, and use Ctrl+V or right-click and paste to paste the image path where it says Path. Then click Import and Close. Now Weasis will open all images for that patient ID. In this video, you will learn how to segment lung lesions, lymph nodes, and liver lesions. To begin, you want to scroll to the slice with the maximal lesion size. If you're looking for the lung lesion, make sure to change your window to lung window. Once you have identified the slice where the lesion is at its greatest size, you want to click the lung segmentation algorithm from the right sidebar. You want to draw an initialization, which will be an ellipse for lung algorithm around the lesion with the center matching the center of the lesion. bring your cursor away from the lesion and the initialization, and then double click outside of it. And you can see that there are segmentations of the lesion in all adjacent slices. Now we will segment a lymph node. Change your window to mediastinum window and scroll to the slice with the maximal lesion size as we did before. Once you have identified the slice with the maximal lesion size, select lymph node algorithm from the segmentation tab. Now draw an initialization, which will be an ellipse as before, around the lymph node. Move the cursor away from the initialization and double click, and you will get segmentation as before. Now we're going to segment a liver lesion. Just like before, scroll to the slice with the maximal lesion size, select liver under segmentation algorithm, and then draw an initialization using a freehand boundary around the lesion. Move the cursor away from the initialization and then double click. You will get the same segmentations of the lesions in all adjacent slices. Lesions in Weasis have their own unique color. As you can see, there is a red and a green lesion. The selected lesion will turn their color to bright red color. Once you have selected the lesion you want to edit, make sure you see Edit On in the editing panel. If it says Edit Off, then click the button to turn it Edit On. You can use freehand to edit the lesion contour. As you can see, if you draw a curve starting from the inside of the lesion and ending inside of the lesion, you will add a part. Conversely, if you draw a curve starting from outside of the lesion and it ends on the outside of the lesion, then you will delete that part. Once you have manually edited the contour, you can make further edits by using our editing tools. You can use our Refine tool to make the contour closer to its true boundary. And as you can see, it can be clicked multiple times. You can also use Smooth to make the contour smooth and remove zigzags. This can also be clicked multiple times. Similarly, you can expand or shrink the contour. Finally, you can propagate the contours to adjacent slices if the lesion was somehow missing a contour in one of the adjacent slices. One arrow will propagate the contour to 2 adjacent slices in the given direction, while 2 arrows will propagate it 5 slices, and an arrow with a vertical bar will make the contour propagate until the last slice. As you can see, there was no segmentation in the next slice, but by clicking the double arrow, now there is segmentation. And you can continue to edit as you need using our editing tools. After you delineate all the lesions of a patient, you need to click Confirm under Quality Assurance. If there are any issues, you will see a pop-up with error or warning messages. The first line shows an error message. It says that slice number 39 is missing a contour. So let's go to slice number 39. Here we see that slice number 38 and 40 have contours, but 39 is missing. You can easily add in a contour for this missing slice. After you add in the contour, you should click Retry. Now you will see only one warning, and it says a lesion is separated into 2 or more parts at slice number 37. Once you've identified an extra contour, you can edit it out using our editing tools. Once you're done, you can click retry again, and it will take you to the next page. Once you solve the QA error and QA warning, Weasis will automatically match lesions in multiple time points, as shown in this tumor tracking window. Each row will contain the same tumor at different time points. And each column will contain all target lesions at a single time point. It's important to double check because some lesions may be incorrectly matched. To switch to images, you must left click on one of the images that you want to switch, and then right click on the other image that you want to switch it with. Finally, you should select the correct lesion site for each lesion. This is the tumor checking window, which contains the graphs and tables of lesion measurements. Once you're done, you can X out and click Yes.